My name is Sarah Muindi. I'm a counseling psychologist, and we're going to be having a conversation on mental health today. And it's going to be exciting. It's going to be interesting. You're going to receive a lot of value, so please keep it locked. My guest today is called Dr. Chitayi Murabula. He's a psychiatrist, and I want to first of all say thank you, Dr. Chitayi, for coming on board and adding your voice to ours. We are running a mental health awareness campaign through the I Support Mental Health initiative that's offering free counseling services to 50 young people over a duration of 6 weeks, and then there'll be follow-up care for them over a duration of 6 months. So if you feel like you need mental health services, please just check out our social media. You'll be able to apply. Now, I want to invite our guest. He's called Dr. Chitayi. I've already said that. So please, Dr. Chitayi, introduce yourself to our viewers.
Hello, viewers, and thank you, Sarah, for inviting me to this forum. My name is Chitayi Murabula. I'm a consultant psychiatrist, also the current president of Kenya Psychiatric Association, with I'll say a total of about 7 to 8 years in the field of mental health. With 3 of them, with 2.5 of them as a consultant psychiatrist. And previously in my previous life, I was a trade unionist who fought for workers' rights. And with time, you realize that a lot of these things are also interconnected. And one can think about, workers' welfare as also having a bearing on their mental health. But yeah, I'm happy that you've invited me for this forum, and I'm impressed by the campaign you're running.
Oh, thank you so much. Okay, so we are going to be going right. I'm even surprised that you were once a trade unionist. That's very, very, it's like a shock in there, but it's incredible to know. Yes.
With Kenya Medical Practitioners and Dentist Union, I was in the team of young professionals who founded that union in 2011.
Yeah.
And in the next 2 months, on 30th August, the union will be 10 years. It has achieved incredible successes for doctors in this country, and led to improvement of the health sector in general, and I'm happy about that too.
Yeah, it's incredible. I know it has also advocated a lot for the doctors' rights, and I know they have received significant support because of that union. I mean, if it didn't exist, doctors would be in trouble, for sure.
Yeah. So let me not bog you down with union affairs. I'm hijacking this forum.
Okay. Back to the topic. So we want to have a conversation about depression, Doc. So what is depression? And then, what is depression?
So depression is a mental health condition, one of the most common mental health conditions. Remember, the human mind, when people talk about the human mind, what does that consist of? It will mostly consist of 3 areas. The human mind will have an influence on our thinking, our feelings, and our actions.
Yeah.
So those 3 areas. And you realize that mental illness is when one of those areas is disturbed. If there's a disturbance in those areas that causes distress, it can be to ourselves or to those around us. So depression falls under those conditions that affect our feelings or the mood.
Yeah.
It's one of those mood conditions. It's a very common mental illness, and one you should also be interested to know that every human being has up to 20% risk of suffering from depression at some point in their lives. It varies between 10 to 20%, so everyone has a risk. So depression is basically characterized, the main characteristic of this condition is that a person will have a low mood. But just a low mood that is equal to sadness. Sadness by itself is also low mood, but for a very short period of time.
Yeah.
But if you have a prolonged period of low mood, but also with other symptoms, so having a low mood, but also just losing interest in the usual activities. You can have lack of sleep, you lack appetite, and by lacking appetite, you lose weight. In some cases, there's increase in appetite. So in certain, you know,
Yeah.
so basically, what accompanies that? So feeling guilty, feeling hopeless, those are symptoms that go with it. And when these symptoms are put together, and they have been there for more than 2 weeks, one then could be said to be suffering from depression. Unfortunately, depression is one of those conditions that also can lead to suicide. You know, um, one of the features of depression is that one will find it. We will find they lose interest in life,
Yeah.
so to say. And it makes sense. Why it makes sense is because these feelings that we're describing on depression, they are very uncomfortable. They are painful. You lose that pleasure in life, and life has meaning when there is some pleasure in it. So if you lose the capacity to have some pleasure in life, then your mind communicates to you then that you no longer need to live a
Yeah.
painful life.
Yeah.
That's how it really leads people to now think about ending their life. One has to realize that it is because of that. It also makes you dysfunctional. Of course, it causes you disability. So a person who is towards depression may be unable to work in severe cases, may be unable to take care of those who are around them.
Yeah.
So they may lose the ability to also contribute to the society. And why, when one also is unable to do these things, they also get these feelings that they no longer need to be
Yeah.
alive. And that's how, again, all the end point can be that a person thinks about ending their lives. It's fairly common, a condition, and in Kenya, for example, it affects, and people may not know that they have any illness. So 2/3 of this group may not know that they have any illness. Therefore, they push through life with the difficulties, but without really knowing what's going on. So it's also sometimes it's called a silent killer in the newspaper headlines.
Yeah.
Depression, the silent. Yeah. So you realize it's silent because you may not know it. Those around you may not know it, but then you live in difficulties, and that's why it's a terrible condition. I think we still need to educate ourselves more about it,
Yeah.
because it affects, it can affect young people, it can affect, but also it's a disease of young people, and maybe the older age groups, they'll also suffer. Interestingly, if a 70-year-old suffers depression, sometimes people may think that it's dementia. So it's also an interesting condition, because you realize that a 70-year-old presenting with some memory loss, then people may say, okay, this elderly grandpa is just getting old.
Yeah.
But it could be depression. So those other interesting ways in which depression shows up are also quite important, and one has to be, we need to know that it can affect all age groups. Of
Yeah.
course, it's more among the younger people, the adolescents to 20s.
Okay. Thanks, Doc. It's
Yeah.
so interesting that you say that some older people can have symptoms of depression, and people, caregivers, family will assume it's dementia. Now, how does an ordinary person know that, okay, these symptoms, this might be a mental health illness, this might be depression, we need to do something? How does an ordinary person has no understanding of mental health, zero clue? How do they tell, okay, when I see my old man behaving this or that way, or when I see my teenage daughter behaving this or that way, this is an indicator that this is probably depression. I need to see a professional.
Yeah, and Sarah, it's really important that as we educate people through our forums, and I'm so excited about the mental health work going on our forums like this, TV, on radio, as we educate people. Let us also tell them about their roles, but also limitations, because I will not expect a person to make the diagnosis of these
Yeah.
illnesses, simply to detect that something may be wrong. That ability to detect, and that ability to detect comes by simply taking note of changes that are happening in people's behavior, changes that are happening in people's behavior. Yeah, so somebody who was very friendly, um, suddenly becoming very irritable, and this persisting over time, right?
Ah, okay. So
Yeah,
the
someone
key
with
is persisting. It's not just being irritable. They might be having a bad day.
a negative change that persists. It should be
Okay.
questioned. A
Yeah.
negative change that persists from a person who used to have good sleep, and now they don't have sleep, and it persists for days. If I like sleep for 1 or 2 days, there's no problem, really, you know. But
Uh-huh.
if someone says that I've not slept for the last 7 days, it should concern everyone. Or I sleep
Yeah.
for only hours a night for the last 7 days, it should concern you. No, if you see someone now isolating themselves, and totally showing no interest in things that excited. One thing that makes people excited in Kenya, for example, is football for the men. Uh,
Yes. You
I
had to
don't watch
bring it here,
football,
dog. Football.
but yeah,
Okay.
I don't watch football. I watch tennis. So for me,
Okay.
it will be tennis. So whatever you like, if you like rugby, and now you no longer you like athletics, you no longer are interested, whether you are doing the sport, or whether you
Okay.
are a fan of the sport,
Yeah.
but you just lose interest. But the English Premier League is very popular. So if someone used to support Manchester United, you know, but over the last 3 weeks, they don't care what Manchester has, and maybe Manchester is doing very well. Just to
Uh,
give an example, Manchester United fans, they are very passionate. So I'm using
yeah.
them as an example.
Yes.
I mean, you may want to be concerned. Okay, what's happening here? What's happening here? There could be something happening. So
Yeah.
a change that over a period of time, and it's a negative change, you should raise alarm.
Okay, Doc, I have another question here.
Yeah.
How do you separate that, okay, this might be a mental health problem or there's a problem, and like let's take an example of a teenager. So a teenager
Mm-hmm.
feels, they decide they're going through the developmental changes, and so they're not coming out of their room because they're having body issues. So how do you separate that this is the normal transition challenges and this is an issue that needs a professional?
Yeah. Sometimes it may be very difficult to actually tell the difference, but generally, what we should know is that during that transition period between childhood and adulthood that we call adolescence, it's a period of vulnerability for the young person because of physiological changes that are taking place in the body. So if you have the young men, they have a surge of testosterone, and testosterone on problems. It is the hormone of aggression.
Yes.
Yeah. And then if you have the ladies, there's the estrogen with all the changes that estrogen can also bring. And uh, the body changes obviously makes them to be more self-conscious, sometimes confused. So there is that, the biological effect of these hormones on the body and on the mind. But there's
Okay.
also there's also the psychological effects on their own. So
Yeah.
the period of adolescence is also a stage of psychological development, or you can call it psychosocial development, that is characterized by identity formation. That's when a person wants to answer the question of who am I, yeah. But also that's when they first grapple with questions of what is life,
Yeah.
and sometimes the patchwork of explanations that they were given when they were younger no longer holds.
Yeah.
you know,
That makes sense.
so So they start asking, why am I here and where am I going? And they start getting exposed to new theories beyond religious studies.
Yeah.
And it can be a difficult period of introspection and such. And also, actually, during adolescence is that difficult period when also these young people realize that adults are actually not perfect. So I loved my father so much. I thought he was everything, but now I realize no, he has some flaws. And my
Yes.
mother said that these guys actually can lie to me and so on. You're not aware. So it causes psychological problems really to this young person. And there's nothing as difficult for the mind as conflict.
Yeah.
Yeah. So when the mind is subjected to conflict, not knowing what is good and bad, you end up in trouble. But also the social aspect of growth in adolescence that involve maybe leaving home to go to boarding school, academic challenges, the pressure academic, you realize
Yeah.
that in as much as our society sometimes pretends that, that they don't give much value to education, people really love education in this country. They place so much value on it. You can see how people celebrate when the results are out. We
Yeah.
love education so much. And that love translates to pressure on our children,
Yeah.
and they have to. You have these children being forced to read for many hours. Probably we are also victims of that system,
Yes,
and
we
so
are.
yeah, so you realize that at the end of the day, that and also now that the social changes also means that this young man or young woman has to take care of themselves more and more. And these are the challenges that also contribute to increased rates of depression and other mental illnesses like anxiety among these children. Period of vulnerability. So, being a period of vulnerability, the emphasis should be on availing counseling services where they may be found, and also mental health friendly environments in our school. For example, the environments must be mental health friendly. Young people must be encouraged to express themselves about what they are going, where they could be going through, the
Yeah.
challenges they could be, but also getting that adequate professional support. Mental psychosocial support in high schools in Kenya virtually non-existent. Probably just a few high-end private schools, but all schools, even the national schools,
Yeah.
non-existent.
It's
Yeah,
true.
you'll only get an occasional mental health talk from Sarah, who has been
Yeah.
invited to one of those, and then
Once
after that,
in a term.
more. So, and you'll go there and tell them that, okay, when you need help, talk to someone, but there's no that someone in the school.
Yeah.
We don't. I we need to create a system within schools that makes mental health, support available. It can start. Schools start with peer-to-peer support. Also, it can start with self-education that these young
Yeah.
people have mental health literacy. Then peer support. Then involving teachers, training teachers, but then also having professionals within the school, even if it's just to deal with the acute stresses after exams and so on, and, 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 and referral criteria and systems where they are referred, but also ensuring that schools, in the school system, there's no stigma, so that people, our children, can be supported, and unsupported, they can come back to class and continue their studies without feeling stigmatized. So there are a raft of things that can be done in schools. Obviously, it requires a lot of systemic change. But just going
Yeah.
back to your question, just question, of course, at the end of the day, if the changes that happen during adolescence could involve some mood swings, some irritability, and so on. Also, if some behaviors persist, some negative behaviors persist, then it could be a reason for this young person to be given help. And for teachers, for example, one way to note that something could be going wrong with this youngster is maybe a drop in their performance without any
Yeah.
other explanation,
Mm-hmm.
discipline issues. So we must think beyond punishing the children and sending them for suspensions and expulsions, and shift the mentality to actually trying to help them with the challenges that they may have. So my high school during my days and just reflected, probably some of my teenage friends depressed, some maybe suffered anxiety, but some could have suffered more serious problems,
Yeah.
even other mental illnesses, so to say, that were never detected, and so they were never helped, so they suffered through. When one is an adolescent, nearly half of them, like 50% of all adolescents, suffer from some sort of depression. But then a lot of it also
Resolves.
resolves
Yeah.
on. Yeah, but if you have a stressful environment, we know that this can persist
Yeah.
to adulthood, and it can really negatively influence their performance in studies and in life.
Okay, so what I'm hearing, Doc, is that the relationship for you, the viewer, the role is to look at the behavior. If it's changing and the
Yep.
change is persisting, then you need to start getting concerned. So where do we
Start getting
say
first.
this is the limit? Sasa hapa beyond here, it's not my work. This is the work of somebody else. When do we say that as a parent, or as a caregiver, or as someone, your boyfriend, your girlfriend, where do you say, okay, this is beyond me offering space for this person to talk to me and tell me what's going on, to it's time for them to see somebody else who is not me?
Yeah, I really don't have that red line to give people.
Yeah.
It will obviously depend with the condition, and you know that mental illnesses are many, over 200. So with each condition, each condition will vary.
Yeah.
But yeah, but you can look at the distress it's causing. The person is distressed. Um, if for example there's a mention of death in the equation, yeah, how small you think the problem is, but
Don't wait.
any increased, yeah, any thoughts, any recurring thoughts about death are a cause to worry. You know, if the person's work is being affected, it's a cause to worry. If it's in school, that performance is dropping, it's a cause to worry. Because what that would mean, what does it mean for a student to start dropping in terms of grades? It means that they're starting a problem, and then their coping strategies are failing.
Ah, okay. So what
Their
they're
coping
doing is not
strategies,
working.
yeah, what they would have used to cope is failing. So now the negative results are now being seen
Yeah.
openly.
Yeah.
Yeah. So looking at these changes, but if there's any also danger to self, or an individual, or another person, threats of death, for example, are taken seriously. A person who self neglects, a person who now no longer now takes a shower, you
Yeah.
know, neglect,
Yeah.
yeah, yeah, or an increase in use of drugs or alcohol, and that is persistent. And that's so there are all these many signs. I can't draw a particular line that this is now the line, because there are different. We can say that there are different items on the criteria that
Okay.
should be used. Yeah, and but if there's concern, sometimes it's just a question of concern. I'm just concerned that there's a change here that I
Yeah.
don't understand. If you don't understand it, and if you cannot resolve it, I know that all families have their own mechanisms, all communities have their own mechanisms of dealing with these challenges, even disagreements, even, you know. So if those are no longer working to
Working.
help the situation move to the next step, we is the
Yeah.
professional.
Yeah.
And let us not be afraid that moving to the professional does not escalate the situation, or by making it worse. It can only make it better.
Better.
So
Yeah.
the perception is that because I've gone to a psychiatrist, does it mean that I'm very sick? It's not that going to the psychiatrist that makes you more sick. It's help.
No. Yeah.
It can make you worse. It
No.
probably it simply opens the curtain on the problem. You know.
Yeah.
So why, maybe one of the reasons why people don't come to psychiatrists and psychologists is because of being in denial. So you don't really want to see the problem
Accept. Yeah.
because it's painful seeing it, and because seeing it can have many consequences. But I can assure people that a lot of times someone can come and thinking that, well, I have a problem, but you could tell them that no, this is just
Yeah.
this is just no stress. You know
Yes.
that
Don't
it
worry.
is. Let me give you an example. A mother who just delivered a child, okay, especially the first child, they
Yeah.
are so anxious the wellness of this child. The child is crying all the night. Maybe the mother feels enough milk. They can be a bit distressed. They
Yeah.
can be moody. They can look like. But if they come, most likely it will just be normal mental health. Yeah,
Yeah.
distress due to the child.
Yeah. Child
Or
birth. Yeah.
some mild anxiety where we just advised that you go home. So the feeling that if you come will give you some medication, not necessarily, and it's not
Yeah.
every day that we diagnosis, and sometimes you time. Okay, so yeah, yeah, like I said, it's persistent. If you have low mood and lack of interest that has lasted for 1 week, I could probably give more time and say, let's observe. The
Yeah.
diagnostic criteria says 6. So I can give you some advice of things to do. Sleep
Yeah.
better, do this, connect with people, touch, play something, play some game, and, and that could resolve.
So what you're saying is that going to see a professional doesn't mean that you are at your ends with and it's just a downward slope from there. No. It's
No,
just receiving
that
support because your coping skills, what you've been doing, is not working
yeah,
anymore.
this is no longer working. So
Ah,
yeah,
okay,
you need
all
you need
right.
support from someone who has thinking on that, and it's because issues can be complex,
Yeah,
and yes, mechanisms can fail, and
yeah.
so yeah, it's best to find that professional support you.
Okay, okay. Now let me ask the next question, Doc. When
Yeah.
somebody has come for treatment, is it possible for an illness like depression to be treated for good? You get healed the way Jesus was healing people and they never had those illnesses again in their lifetimes. Is it possible to receive treatment for a mental illness, example depression, and be treated for good?
Sometimes even some illnesses resolve on their own without any treatment.
They just resolve on
Yeah,
their
sometimes they
own.
yeah, sometimes they just resolve on their own. Okay, but still, yeah, those who come uh, up to let's say 6%, yeah, of people they'll get healed completely.
Ah,
Uh,
yeah.
never have any, you know. So a high percentage of people suffering from these conditions like depression will get treated, will stop medication, and they never go back. In some cases, yeah, they'll get better. All right, they may relapse when,
Yeah.
especially for like new psychosocial stressors. Let us
What is
remember.
relapsing and what is psychosocial stressors?
uh, So, so relapsing is becoming sick again after you had recovered.
Ah, okay.
You had recovered, you came, you are treated, you recovered, you stopped taking medication. Then the illness came back, and you
Yeah.
needed to come again. That's a relapse. So it happened, and it happens because of stressors. Especially, you remember that depression also one of the factors that lead to depression is recent events, what one can call some social factors that have to do with, yeah. So loss of money, loss of a loved one, loss of freedom, loss of a spouse, loss of
Yeah.
this, all this can lead to it's accumulative loss of money really also. and then we are talking about COVID-19 that has some of these psychosocial stressors. So,
Yeah.
if you are being treated and now you encounter some of these, I mean, let's talk about, for example, loss of a parent. It can be something that is very difficult to deal
Yeah.
with.
Yeah.
So that it's a risk, and that's why if you're already taking some medication for depression and you lose a parent, you don't need to be. You need to just go into some grief-related counseling to help you cope with that loss.
Yeah. So it can
Yeah,
you can be
and
treated
need to wait.
properly. Uh-huh.
Yeah, I mean, you need. I think what people also should learn is we can preventive treatment. You know, if you encounter huge loss, even before you encounter any symptoms, you could check yourself into hospital and say, I want to stay here for the next 2 weeks,
Yeah.
and receive
Yeah.
therapy and so
Uh-huh.
on to prevent, me from getting into depression or into anxiety.
Ah, yes.
Yeah,
You don't have to wait
yeah. This
until things are at the red line.
no. Remember, anytime somebody suffers from a mental illness, a break thoughts, an episode, there are always negative consequences that are associated. There are losses. You may fail to go to work. You may expose yourself to a risk to yourself or others. There will always be that negative and dangerous that may happen. So to that you could come beforehand because you are encountered a loss. Get your psychologist. Let them help you go through that loss, process it, and
Yeah.
come back.
Yeah, so you don't have to wait. You don't have to wait for things to get critical. You can't function, you're not productive. You can actually take the responsibility yourself to seek support earlier.
Yeah. And just to answer your question, yes. So people who are treated for depression get well. Unfortunately, for like disease, there'll be also a small percentage that maybe will continue struggling with some of the symptoms. And it's a small percentage, and it really depends because of the many factors that are associated with depression. Perhaps you definitely, even for depression, definitely there are some varieties of it that are not responsive to all current forms of therapy,
Yeah.
and still growing. So
Yes.
maybe we'll get some, more effective treatment that where everyone gets better. But are still going on. Remember that these are diseases that we are still studying to understand
Yeah.
them more. So,
Yeah.
yeah.
Okay, good. So yes, you can get treated and recover fully and never go back. But sometimes, depending on what the situation is. Yeah,
Yeah.
sorry.
The majority of those will recover.
Ah,
Right?
yes. Yes. The majority get well completely.
Yeah. Also, the question of why do some patients not recover is an
Uh-huh.
important question.
Yes.
Yeah. That's a separate question. Why is it that some patients don't recover? So it's not only that because the treatment is not working. Sometimes that maybe the treatment is not being taken.
Yes.
Okay.
Yes.
Yeah.
It has
So
been
you give
prescribed, but it's not being consumed by the
yeah,
patients.
he's afraid of the medication, so he's not taking the medication too. Maybe they're not taking the medication because they fear the side effects. So medications have side effects. One of the most distressing ones that people don't talk about much is reduced libido. You can have reduced libido after taking this medication. Maybe it's making you sleep a lot,
Yeah.
or so people sometimes they stop taking the medication. Another reason patients do not recover, it could be something to do with um, ongoing psychosocial stressors. So there
You're
are other
receiving
stressors that
treatment, but the issues are still there.
they are in an abusive relationship, maybe,
Yeah. And you
or
haven't left the relationship.
you haven't solved the issues in the relationship. So
Ah.
that can be a problem. It could be that 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 the and also issues of substance use. So depression, we are treating you for it, giving you medication, but you are taking cannabis, right? Alcohol. or mirror that interferes with this, that interferes with therapy, is another factor that
Yeah.
can be problem. Yeah, and lastly, it can also be the question of diagnosis. So this diagnosis of these mental illnesses is also not a walk in the park.
Yes.
I always give this example, and I hope it's not a bad example, that if I'm a doctor seated in an accident and emergency department of a hospital and someone walks in with appendicitis, I'll probably diagnose that person in 10 minutes. Just 10 minutes, I'll know this is now a diagnosis of appendicitis. But if
Yes.
I diagnose the patient, I'm not sure if I can take anything less than an hour to actually make
Yes.
that diagnosis.
Yes.
But the thing is that the relation, you can have depression, but then these symptoms of depression also be present in other conditions. They could be related to anxiety disorders. They can be related to post-traumatic stress disorders, related to bipolar mood disorder. So it can be a depressive phase of a bipolar illness.
Yeah.
So sometimes that is missed maybe by an inch. All right.
Uh-huh.
Recovery may be difficult because maybe the focus may be on something different. But again, also mental illness with each other, like you can have more than one illnesses.
Yeah.
So, so if you have depression and health, that's something else needs to be treated as well. Yeah.
Yeah. Okay. Now let me ask a question. Uh-huh.
Let's say this before I will forget. I can assure you, if I don't,
Yes, say. It's okay.
you can also have depression caused by a physical illness in the body, like a hormonal,
Ah.
like low thyroxine. It's called hypothyroidism. Yeah, or diseases like Cushing syndrome. It can be another disease that actually needs to be treated, and it's not depression per se. It's actually it's a symptom. The depression is a symptom of another physical
Of a
disease.
different
So again,
illness.
so for these patients that we also treat and are not recovering, we need to go back and also for them a physical workup. They could be a hormonal issue.
So it may not just be, it may not even be a mental health illness. It might be triggered by, it might actually be a symptom of a physical illness.
Yes.
Wow, wow. Okay. Now, explain for us, Doc. Some people, when they go see professionals, they are diagnosed with high performance. They are high performing, but they have depression. Because you see, some of the symptoms you have mentioned are, changes in behavior, low moods. But somebody is going to work, they're on a job vizuri, they're performing very well, but they're depressed. Yeah.
Yeah. So, is it possible? Yes, because also think about depression as having stages. There is mild, moderate, and severe depression. I will truly be shocked if a person is performing better as severely depressed than when they were not depressed. I will be shocked. It will be depression giving you the opposite effects of what I expect. Severe
Yes.
depression, I can bet that their performance is going to drop. Their performance is going to drop. In milder cases of depression, the performance could go on as it were,
Yeah.
but the person will be exerting themselves more. They are using more effort in the same task. You may say, okay, they are still giving us the results. The person is still giving the results at the workplace, but over a long
It's
period of
taking a
time
lot
or
more
over time,
energy.
they're using more energy, and since they're using more energy, they may get exhausted. So eventually, the performance may still end up dropping.
Dropping.
So,
Yeah.
I don't want to say really that uh, that that depression is compatible with high performance.
Yes.
Unless if it is a case of mild depression, and there could be some factors at work that also may make it easy. Obviously, if your workplace is friendly and so on. Also, your other factors in life, there could be some depression, but you have a lifestyle that really helps you cope, then there's no major stressor. You have a family, you're connected, you have a hobby, uh, and so with those factors, then you could still continue to perform. Maybe your depression may never really become severe, So
Yeah, yeah.
yeah.
Ah, okay, all right. Now, what's the role of therapy here? What's the role of going to see a professional? Because people say, me, I can't pay someone to talk about my problems. But what is the role of therapy when it comes to treatment of mental illnesses, like depression, for example?
Yeah, so therapy has a number of roles, but one of the most important one is education, psycho education. There's the education part where somebody is helped to understand what the problem is. Before you put a name to, before before you point it out, you'll be boxing in the shadow, in the darkness,
Yeah.
and it's very stressing to fight an unseen enemy.
Yes.
They meet you in open battle.
True.
Yeah. So one thing therapy will do is take away take away that darkness, and help you to understand perhaps what caused this problem, So factors contributed to this problem in the past, in the present, you know, what factors may continue to lead to this problem being there. All right. It can also help in understanding what are my strong points with regard to this. What are the positive factors, so that we try to enhance the positive factors and reduce on the negative, and the negative factors could just be maybe could be your pattern of thinking, it could be your behavioral pattern, yeah, it could be a behavioral pattern, and so yeah, so the negative, it could be negative thinking that has different components. So human beings, after encountering some traumas in their lives, sometimes take up a negative view of themselves, of the world, and of the future.
Yeah.
And if you have that kind of thinking, or pattern of thinking that is negative, then what happens is that you become vulnerable to depression. But if you become vulnerable, but if you're already depressed, but you still think like that, then what happens is that you will end up you'll struggle to recover. You'll struggle to recover. Therapy really helps to fix the patterns of thinking through certain. There are several techniques,
Yeah.
but it involves recognizing what is that negative and challenging it, and replacing what is
Replacing it.
positive,
Yeah.
and then practicing what is positive for a period of time, so that it becomes part of you. So that is the science of what we call cognitive therapy, and also behavioral therapies. You are simply
Yeah.
replacing something positive, and then you practice what is positive.
Yeah.
And the good thing is that our behaviors are learned, and they can be unlearned,
Yeah.
through a series of steps. So this is
Yeah.
basically what happens when somebody comes to therapy. Um, so the truth that we do not want to see is what was it. But also depending on the type of on the type of predisposing factors, or factors that led to the illness, there could be different types of therapy. So there are therapies that focus on your past, like childhood traumas, like psychodiagnosis. There are those that focus on the here and now, like uh, and behavioral therapy. So, and there are those that focus on resolving acute crisis, like supportive psychotherapy. So there are
Yeah.
different therapies that will focus on different problems. However, one of the most important factors in some of these in these therapies is given through a story of a lady who was called Anna O, that was treated by Freud, whose problem she was hysterical. She used to be hysterical, uh, and she had hydrophobia.
Fear of
So
water.
this lady, yeah, she had the fear of water. So this lady during one of her sessions, um, while the system of treatment then involved somebody talking freely, which was called free association.
Yeah.
So you just talk whatever comes to mind.
Yeah.
So during one of these sessions, this lady then remembered that there's a time she had seen a dog drinking from a glass of
Okay.
water, and because she was disgusted, had water from there on. So, but she had forgotten. So when she remembered that,
Ah.
the problem was resolved. So some problems will be resolved by just remembering the truth,
Yeah.
knowing the truth, and so for some patients they'll be healed by knowing the truth and reassociating. So that's reassociating the fear of water with an event that happened. Because if
Yeah.
you do that, then you localize back the event to that, to your feelings to back to that moment, and now by reason the problem did resolve for that lady,
Yeah.
but also created an important lesson uh, uh, how people can be healed from traumatic events. How people can be healed from certain traumatic events that they are forgotten. Because if a traumatic event that was so painful, my mind is quick to forget.
Yes.
So
Yes.
it simply the unconscious part of the mind. So it goes there. We call it repression, but then
Yeah.
it shows up my daily activities by I either mess up, I either become too anxious, and so on, because it's like a form of allergy. You know,
Yeah.
it's like I was walking in a forest and I was bitten by an animal, which I didn't know what it was. Okay,
Yeah.
so I feel the forest totality or all animals, because something bit me.
Yeah.
It's also like that. You get hurt, you get the pain, you don't remember hurt you, so you think everybody hurt you. So you must
Exactly.
go back. Yeah. So going back
Yeah.
to that truth itself can be important in healing, you know. And these are issues that can also be explored in some of the psychotherapies
Yeah.
that are there. And it's a long history to this, and people have been helped out of this. So just like medication, also therapy will depend on the problem. So there's no one shoe fits all. It will depend on your problem. If your problem is, I don't want to go so much into this, but if your problem is attachment problem, you have attachment problem. There are people who had problems when the attachment was forming in early childhood. So
Yeah.
so then either have an attachment that is insecure. There are types of insecure attachment which I'll not go into, but insecure attachments then lead to problems in relationships. So if someone, for example, has such a problem, then probably they will need something called interpersonal uh, therapy. So it will then depend on whatever
What's the
challenge
issue?
that the person is having, and the discussion will be with the therapist. Always we will guide, the direction that goes, what the person needs, and so on. At the end of the day, you realize, Sarah, let me say this: I've had some colleagues crashing the use of medication or of mental illnesses.
Yes.
It becomes, you know, uh, there's interruptions. There was a brief interruption. Can you
Yeah.
hear me?
Now I can.
Yes.
You were at rushing of treatment of medication, prescribing medication.
Yes. There are people who are taking extreme positions about what works and what does not work. I don't know if you can.
Yes, I can hear you.
Someone is still trying to call me. So so the point is, can you hear me?
Yes. Yes, I can.
The point is that mental illnesses can be explained in terms of biological, psychological, and social causes. All right.
Yeah.
And for that reason, there are always a patient will always benefit if there's some biological component to their treatment, which can be medication, which can be electroconvulsive therapy. So they can be a biological. There'll be some psychological treatment, which can be one of these psychotherapies we've discussed. Then there can be social treatment, which, for example, brings in the whole family, like family therapy or
Ah.
lifestyle changes to their lives, you know. So we tell them to exercise, we tell them to connect, and so on. So this falls under that group. So a good mental health practitioner should emphasize the importance of all these forms of treatment. There are some patients who will immediately first benefit from a medical treatment. I'm thinking of
Yeah.
a patient like severe schizophrenia or bipolar mood who has no insight. You may not start with that patient on
On
psychotherapy.
therapy. Yes.
In case of depression, you may do both medication and psychotherapy
Yeah.
and social therapy. So there's a combination of treatment. If you become narrow-minded to say that medication is bad, then you'll probably struggle with your patients, because
Yes.
medication, there is studies that have been done that they actually, there's a benefit to treat this medication. So let us embrace each other, but let us
Yeah.
also emphasize teamwork. There's need for teamwork.
Yes.
So someone that they will treat you alone, then they will be doing a very good job. Sometimes a person needs to refer the doctor, the psychiatrist needs to refer sometimes to a psychologist for some advice, the psychologist to a psychiatrist. Sometimes you need to bring in an occupational therapist into the team, a social worker, for optimal outcomes for our patients.
Yeah. Thank
Yeah.
you. I like the note you have ended on. I will not even add anything there. I'll just say thank you, Doc, for making the time to have this conversation with us. I want people to digest what you have said and just, let it internalize for them. And I want our viewers to leave having watched this video with a clear understanding of the direction to take. If you're a professional, of course, you have been helped and you have had. We need to work together. I want to thank you, Dr. Chitayi, for making the time to have this conversation with me and for adding your voice to ours and helping us amplify the message on mental health awareness. It's incredible. I also want to thank our viewers for being part of this conversation. And I also want to remind you guys, if you're in need of free counseling services, you're young, you have to be between 20 and 35. You can come to our social media pages. You'll find the information there on how to apply, and we'll be able to journey with you and help as much as we can. So we are wishing you the very best. Doc, thank you so much. Have an incredible afternoon.
And before you go, I'd just like to say that for those who are on social media, you can check out the hashtag Mental Health 254 to follow the mental health awareness campaign by Kenya Psychiatric Association that's running until the end of.
Awesome. That is Mental Health 254 on all social
media platforms. Yes.
Okay. Good.
All
right. Thank you, Doc. Thank you very much. Have an incredible afternoon.
Nice afternoon too. Bye.
Okay. Bye.